our February virtual collaboration forum. Thanks to everybody for joining us today. We've got a very active agenda, and I'll just kind of give you an overview of what that looks like. But before that, let's talk about why we're here and why we're always focused each and every day, and that is our promise. And you know, our Cook Children's Promise says that knowing that every child's life is sacred, it's a promise of Cook Children's to improve the health of every child through the prevention and treatment of illness, disease, and injury. And that's why we're here, and that's why we're talking today, to figure out how we're going to be more aligned at doing that and taking care of each other in the process. So our next slide, our agenda today looks like this. Our very own Dr. Pam Foster is going to get us started with our invocation, and I'm looking forward to that, as well as the other presentations. Lauren is going to talk to us about the Blue Peaks Giving Circle and that grant cycle that comes with that. Kevin Green, our Northern Market person, is going to talk to us about Prosper and everything going on with our planning out there on that beautiful campus that we're building. Tara is going to talk to us about how we're transitioning from a construction project to an operational project where we're going to deliver excellent patient care and take care of our employees in the process. So she's going to tell us what that process looks like. Doreen is going to talk to us about some friends that are coming, and they're probably closer to coming now than they have been in a few months because of where we're at, and she'll talk to you about that. Cami is going to talk to us about introducing our system burnout survey for fiscal year 22. And Cheryl and I will wrap it up to see if there's any questions that haven't been answered, but also to give you some feedback to some key things that are happening around the organization. We encourage everybody to input any of your questions into the chat session. And during the presentation, the presenters, when they get a chance, they'll answer those. Or if we don't get a chance during the presentation, we'll make sure we follow up with that to the audience here, make sure we get an answer to everything. All right, if there's no reasons to stop, we're going to go ahead and move in, because we're not stopping. There's no reason to stop us now, whatever the song was. Ain't no stopping us now. We're going to transition to Dr. Foster for our invocation. Thanks, Pam.
Hi, Stan. Thank you. And hello to all of you. It is my last collaboration forum with you. I'm retiring at the end of this month. I'm sure you've read it. I cannot tell you how much you mean to me and how glad I am to have served with you all these years. And I know that you are going to enjoy working with Jennifer going forward. Please know that you'll be in my hearts and my prayers. I am going to repeat a prayer that I have used before that is taped to the Pam side of my printer. And I look at it and refer to it often. And I hope it speaks to you as it has to me. God of righteousness, I pray for wisdom and courage for our leaders. And Lord, should you call me into leadership, should you call me to speak up for the weak, instigate justice for the poor, or defend the accused, I pray you will provide me whatever is needed to be your servant. Amen.
Amen. And Pam, I wish that everybody had a chance to speak to you right now vocally, but I know they're doing it in many other different ways. We so very much appreciate you and the foundation that you've laid here, not only through your team, but throughout the organization, and the goodwill, the gestures, your heart, your caring, your fun way of helping us to get through, you know, moments that we didn't know we'd be able to get through, but just being who you are. And we wish you nothing but many more opportunities to impact yourself and your family and others with your caring and your kind spirit that you possess. So thank you so much, Pam, for all that you've done for us. And we look forward to hearing about the many fun things that you're going to be doing in the future. This is always home.
Thank you, Stan.
Appreciate you. All right. Thank you. Next, we're going to transition to Lauren, and she's going to talk to us about the Blue Peaks Giving Circle. Lauren.
Well, hello there.
Hey, Lauren.
Thank you, Stan. Hi, I'm Lauren Tevis from the Health Foundation. I'm here to share with you a little bit about the Blue Peaks Giving Circle and our upcoming grant cycle. Today, I'm going to share with you a little bit of eligibility requirements, dates to know, and where you might find the application. So our Blue Peaks Giving Circle is a new annual philanthropic giving society. This group is focused on collaborative giving. So all of the members pool their funds together, and they're split two different ways. 10% of the overall funding is going to a new endowment to help ongoing needs within the system. And then 90% is going to grant making opportunities across the system. And so they will vote on those at the official Give dinner in October. So we encourage everybody to apply. You just must have direct impact on patient and family services. We anticipate granting $140,000 to $200,000 this year, and the minimum requirement for a grant is $1,000, and the maximum request amount may be $40,000. Each department may apply for up to 2 separate requests. And so we'll talk through some of these dates to know just very quickly. The grant application was sent out on February the 14th. You all have from February 14th to April 8th to apply at 5 p.m. There's a Dropbox link. After those applications are received, they will be reviewed by a couple of different folks within the system leadership, and you all will know by April 25th if you've moved on to the semi-finalist category. After they're reviewed by system leadership, we have a committee of Blue Peaks grant members who will review these requests and select as finalists. And so those finalists will all participate in our Give dinner. So next slide, please, Laura. So we will have 2 dates where we'll be filming videos. Those are August 31st and September 4th. It'll be about 45 minutes, and you'll be sharing what your grant request is, how much you're asking for, why it's so impactful to the system. These will be shared at the Give dinner, and then also in some ancillary materials. And then October 6th is when all the members will come together and vote on where the funds will be placed. And so it is mandatory that there's one representative that will come to answer questions and share more about the program that you are applying for. And after that, you'll be notified that evening whether you've been selected for funding. And then there will be 2 dates, March 2023 and September 2023, for 2 just mid-year progress reports, end-of-year progress reports to share all of the wonderful work that you have done. So you might be wondering, where can I find these proposals? Well, they are listed right there on CookNet. You can either go to the left-hand side of CookNet, click on the Health Foundation link, scroll a little bit of the way down, and you'll find a link to the application. Or you can type Blue Peaks into the handy search bar, and it will come up first thing. If you all have any questions, you can email bluepeaks@cookchildrens.org, and we look forward to hearing from you. Thank you so much.
Great presentation. Thank you, Lauren, for sharing that valuable information, and look forward to everybody learning more about it and getting involved, and contacting Lauren or her team if there's any questions about it. So let's get engaged. Thank you. All right, our next presentation is from Kevin. He's going to talk to us about what's going on at Prosper from a campus readiness standpoint.
Absolutely. Thanks so much, Stan. I just want to say I'm excited for the opportunity to be here with you all today and to provide an update on not just the growth taking place in Prosper, but all the amazing things going on throughout the region. And so in this first slide, I wanted to be able to demonstrate and really say thank you to everyone that's been involved in the process over the last few years. So when you look at that first kind of line, the blue line, when you have our numbers and where we were just a couple of years back in 2020, you see we started with 16 pediatricians. That year we had 2 acquisitions that included 5 pediatricians. We started our first de novo clinic in McKinney with Dr. Bailey. And just at that time, we cared for about 14,250 unique lives in this region. And in just 2 years, we've doubled that to where we now have over 31 pediatricians within the CCPN network, 3 advanced practice providers. In 2021, we had 3 more acquisitions, which included over 9 pediatricians. We opened our second de novo clinic in Allen and now care for over 39,000 lives. And I just want to recognize the incredible success and growth that's been and everyone that's been involved in that process with our leadership on CCPN with Dr. Zurich, Robert Goodwill, Teresa Baker, CCPN recruitment, but also all the other departments, IT, HR, construction, just everyone that's been involved in this. I think it's a great success story, but it's only the beginning of what we're seeing up here in Prosper and throughout our region. I wanted to make a few notes that when you think about our service area, currently there's about 250,000 children that fall within our age range that we care for. But in just the next 10 to 15 years, that number is expected to double. Which is amazing to think almost over 500,000 kids will be in this service region. And when you think about that growth, what's even more exciting is that the majority of that's going to take place north. So when you look at Salina, Aubrey, Melissa, Anna, that is where you're seeing the major development. And so with all those homes coming online, all of the people moving here, Cook Children's is going to be sitting right in the center of it. So you have a dense environment just south of us in Frisco and Plano and McKinney. But then you add that second layer just north of us. I just think we are perfectly positioned to be able to become the pediatric provider of choice for thousands of families. And it's so exciting. So just want to kind of say thank you to everyone that's been involved in that so far.
Hey, Kevin, if you would, before you define de novo for everybody.
Yeah, so de novo is a true startup. So we have acquisitions, which were already established practices. De novo is a brand new practice. So, with Dr. Bailey, she was new to the market. We found a location and we put her there. And she has had great success. Even though she started in the middle of COVID, she is now very busy, and we're already looking to grow that practice and add another pediatrician. And so great question. And if you do have any other questions around the primary care network or anything CCPN related, please put that in the chat box. And I know Teresa Baker will be able to provide some answers there as well. So going now to the campus, I kind of broke it up in 4 different sections. So when you think about the services that we currently offer, starting with our urgent care, and if you look at the picture, it's in that kind of upper left-hand corner. You look on the north side of that, which is, I guess, when you look at the picture on the right end, that's our urgent care. That clinic opened October of 2019. And I first want to recognize them because they were out here on an island for about 9 months and really were that face of Cook Children's to this new region, this new market, and have just done a tremendous job. So, want to thank Dr. Kara Starnes and so many that were really instrumental in helping us create that Cook Children's experience and building that strong team in our urgent care. Since opening, we've seen over 28,000 visits in just a little over 2 years. I think that's incredible and a great representation of the market. But what I thought was unique when I was talking with Teresa Baker is of those 28,000 visits, 4,700 families did not have an established pediatrician. A lot, when you look at our demographic, of course, we have some that are from the region, but we are seeing thousands of families move here, as we all know, from throughout the country. And this is a very young market. The average age is 37 years old. And so when you think about that, I think that, having Cook Children's here is a great resource for our families to be able to find that pediatrician and to get connected. And so we have been able to, as you saw that primary care map, when a family comes in that doesn't have a pediatrician, or they live in Salina or McKinney or Plano or Carrollton or Prosper, we have our pediatricians there ready to accept them and take care of them and to connect with them. So it's been a great success for us there. And then you look at the market, 78% commercial. It just represents the growth that is happening in this region when you think about businesses and families that are moving out from your more metropolitan areas to your suburban areas. And once again, we're positioned very well to be able to support that. When we talked about primary care regionally, but in that same building is the urgent care on the south side is our primary care clinic. So we started October of 19 with Dr. Audrey Johnson, and in just over 12 months, we've gone from 1 pediatrician to 3, which I think is incredible growth to be able to add 3, or to have now 3 pediatricians in just under 2 years. But once again, is a representation of that market and the growth just right around us. If you look north of the campus, that's a development called Windsong that will have 3,000 homes in there. And that same developer is actually adding on 700 acres to put another 1,500 homes right behind it. So you'll have almost 4,000 homes within about a 10-minute drive of our campus. And so we are very fortunate and excited for that. You look at the surgery center. Historically, this center was located in Plano and has been a part of the system for about 13 years prior to moving to Prosper. But it's so very important. We have about 25 physicians that practice there. You see the areas that it covers. But a big part of it is because our goal for this campus is to provide all services on one location and primarily under one roof, under the 3 peaks. And so, whether it's urgent care, primary care, your outpatient surgery, or your specialty visits, which we'll talk about, those families don't have to go anywhere to be able to receive that care. So, we've been able to see great success in that center, just over 3,600 procedures last year alone. And as we continue to add our CCPN specialists, that center will only get busier as we continue to grow those services there. And then lastly, we talk about our specialty clinics. On the second and third floor of the MOB, we have 15 Cook Children's specialists supporting 13 specialties. And this opened about a little over a year ago. And just in that time, we've seen, which I think now will be over 12,600 visits. But I think what's the biggest takeaway when you look at our specialty visits is historically, this market was very fragmented and challenging for families. So if you lived in Prosper and you needed to see a urologist, you would have to travel to Frisco. And if you needed to see a cardiologist, you would have to travel to Dallas. Or they may travel to Fort Worth with Cook Children's. But now the system understood the need to be able to have all those services and support under the 3 peaks. And so from day one, we have now 13 specialties here for our families. And so a great story that Dr. Anani, our medical director, likes to share is, there's so much overlap between his specialty and urology, and they practice right next to each other in the clinic. Where now families, if they come to see him and he notices an issue that needs to see a urologist, instead of that family have to giving another appointment to take another day off of work or their child out of school, Dr. K now walks across the hall and into the clinic. And it really is a beautiful experience. It really, I think, embodies what we talk about when we say the Cook Children's experience, where the family and the child is at the center of the care. And so it's been so well received by not only our families and our patients, but our physicians and providers. So kudos to that team there, and I think they've done a great job. Laura, next slide. So high level, real quick, just wanted to kind of give everyone a reminder of what the medical center is going to include day one. I won't go through each of these bullets, you can see it, but just starting at the basement, you have some of your ancillary support, obviously your lab and your pharmacy. There is shelf space in there for it to grow as we add additional beds on board. The first floor, you have your dietary, your emergency department, your supply chain. For the ED, I put 10 beds day one. The emergency department is actually 20 beds, and we're going to have those beds fully built. Day one, all we'll need to do once we need, whether it's one additional room or the remaining 10, all we have to do is buy the equipment. And I just want to say thank you to the system for investing in that up front, because we do have expectations that this will grow quick. And so that delay in being able to turn a bed on will be limited because all we'll have to do is buy the furniture. You look at the second floor, that's our peri-op suite. Day one, we'll have 2 ORs. We'll have all 4 built, but only 2 equipped. And similar to the ED, we'll just add the equipment as needed as we see that growth. We'll also have a spa, which includes our 2 endoscopy suites and our 1 bronch room. All 3 of those rooms will be built day one. The third and fourth floor will be shelled. They are designed to have 24 inpatient beds on each floor. And then the 5th floor is our 10-bed PICU and our 14-bed med-surg, which will be all built out and occupied day one. Next slide. And so I think we wanted to level set with the system and just to kind of give a high level update of what we expect to care for and Prosper day one versus how we're going to partner and collaborate with our family in Fort Worth. So you kind of see from a high level, we walk through some of this. We'll have our emergency medicine, our general medicine that we'll see on the medical surgical floor. We'll have a pediatric ICU, our surgical services, sleep lab. We'll have 4 sleep rooms that will come online with the hospital. We'll have an infusion center that will consist of 9 bays that will come online with the hospital. All 9 will be operational. We'll have our imaging, and you look at the different modalities there. And so with that, the only one that we won't have is nuke med. So that'll still work with our team in Fort Worth. And then you look at our specialty coverage. And so the kind of the difference here is that our hospitalists will be the primary focus of care for the children that are admitted. And then our specialists will support them as a consult needed. But with Fort Worth, you see, we're still going to collaborate with our NICU, our trauma patients. You look at some of the subspecialty our inpatient needs, and then some of the other items. So there's going to be a lot of collaboration day one and what that looks like, and making sure that every child that needs care with Cook Children's, whether it's here or in Fort Worth, we'll be able to take care of them. And Cheryl, if there's anything else you want to add as it pertains from a nursing perspective.
No, I think you captured everything. Thank you.
Yes, ma'am. And next slide. And then lastly, I just wanted to I think everyone may have seen some invites coming from Laura this morning. We're going to be having a monthly, what we call Prospercast, that'll be going out to the system. And this first one, which I believe is next Thursday, is going to be focused on recruitment and hiring for the hospital. And so if you have any interest in wanting to learn more about opportunities, please join in. It'll be myself, Cheryl Peterson, Beth Schmidt, and a few others to talk about that. We're so excited that we're now at this point. We'll have quite a few opportunities. And so, of course, we first want to get that out to the system and be able to answer any questions you all have. There'll be two opportunities, one for our I guess, day shift, and then one for the night shift. So please let us know if you did not receive that invite, and we'll make sure to get that information out to you. And I don't know if there were any questions, but Stan, thanks for the opportunity to be able to once again talk about all the great things currently going on and what's to come.
All right, thanks, Kevin. Great presentation. I saw that there were a few questions, but Cheryl addressed all of them. So thank you, Cheryl. All right, next we'll transition to Tara, and she'll talk about what that looks like from a Prosper transitional planning perspective. You're up, Tara.
Thanks, Dan. Hello, everyone. Like you mentioned, I'm going to be talking about transition planning. So all of the wonderful things that Kevin just mentioned, a transition plan is outlining all the tasks and activities that need to be performed in order to operationalize the building once construction is done. And so as transition planners, we try to help identify the teams responsible, any tools, techniques, and methodologies that are required in order to all come together for our first patient day. And so one of the things is ensuring that all of the teams have the same foundation. Transition planners can't be in every meeting. And so making sure that we can all come back to a set of guiding principles that help us make those decisions and have those conversations. And so, ultimately our number one guiding principle is safety for not only our patients and our families and visitors, but also our staff. By having a really strong coordination plan, we're able to minimize any disruption to the staff and people who may be coming in and any of the daily activities that are associated there. Another part of transition planning is making sure the whole organization is engaged and well informed throughout the process, and making sure that we're communicating well throughout all levels of the organization, which is a good reason that I'm presenting to you guys now, and that we have fun activities like Prospercast coming out. And lastly, this is a large effort within our system. And so we're utilizing system teams, leadership expertise at the downtown campus and across companies. And so we want to ensure operational stability, not only for our current activities, but also the future ones at Prosper. Next slide. And so a part of transition planning is creating a milestone schedule. And so this is to show the building in construction mode and then operationalizing. And so really trying to make sure that all of these items here are aligned, coordinated, and executed at the appropriate time. This can be like a lot of different things. This can be medical equipment that has really long validation, making sure that is installed and tested within the right amount of time. It's making sure that the furniture is delivered, but that it doesn't impede IT's capability to install their equipment and to test. It's making sure that all the supplies are stocked in the units before state inspections. And a really important reason is recruiting the staff, making sure that, we bring our team on board and that they're trained and oriented to the space and that they're really familiar with where they're working and where things are. And so I know this looks very simple and pretty and looks like it'll get done pretty easily, but if you go to the next slide, I think transition planning feels a lot more like this. So we have a lot of different teams, a lot of different projects going on, a lot of different conversations, and transition planners are really just trying to bring everybody together and on the same page and A good note is that the hospital does not look like a collapsing ship, and we have a lot of great teams that are working together, not only within the organization, but our partners too, our construction teams, our architects, and everybody is really excited to start seeing new patients, and everybody's dedicated to making the hospital come together as efficiently and easily as possible. So we are all getting really excited, but we do feel like Spider-Man sometimes.
Great presentation, Tara. Yeah, there are a lot of things that go into starting up a new hospital. You know, it's been a long time since we've done it, you know, over 100 years with the first original 2 hospitals in 1985 with the current campus that we have downtown. We've added on quite a bit, but we've never really stood up from the perspective of, you know, starting a hospital in a long time. So a lot of great work going into this. Thanks for working with everybody, facilitating the alignment and the guiding principles. And we appreciate everybody's efforts that have been involved, because we know a lot of the leaders who are engaged with their teams and operations here in the system and on the main campus have been instrumental in getting us going. And we'll transition that to the staff that'll be at Prosper soon. But kudos to everybody who's spent the time to just interact with the meetings and talk to the designers, go out to Prosper, everything that we've done to make this a success. So great planning on that. So thanks, Tara, for that presentation. Okay, next we'll transition to Doreen, and she's going to talk to us about any and all things Joint Commission.
Thank you, Stan. Excellent. Okay. Okay, when I was here last time, last month, it was, I think, the 12th or 13th of January. And at that point, we were looking at January 9 data, and we were noticing that we were starting to increase. We were 12.23, and this is our COVID numbers of cases that we get from Joint Commission on a weekly basis. We look at this as kind of a barometer to know whether or not we're getting close to our survey. And just as discussed last month, our numbers climbed, and we kind of skyrocketed for about three good solid weeks, 4 good weeks. And as you could see, in early February, we started to go back down. And then as of this Monday, we've gone down even lower, 15.57. So we are, which is really good for many reasons. So we are going back to a more acceptable range for our survey team to arrive in a full team that's vaccinated in person. So it looks like that will happen much sooner than later. Again, I don't know a date, but our Joint Commission consultant tells us she'd be surprised if we're not scheduled really soon, and we have one sooner than later. We're about 6 months post our triennial date. A lot of hospitals that got delayed because of COVID last year, their survey was anywhere from 6 to 11 months, and some of the ones that took longer were because they lived in regions of the country that had high case numbers. But our numbers are going down, we're looking really good, so don't let your guard down. Our consultant thinks they're going to come real soon. So with that said, I thought I'd take opportunity this meeting to go over some findings from our 2018 meeting. And the reason why I want to do this is because Joint Commission will have this information. They'll provide this to the survey team right before they arrive. So it doesn't matter the location where we received our RFI on this, they will look for this everywhere. So I'll go through this just a high level. Just to refresh y'all, so you can look in your areas and be aware to make sure we're compliant in all things, but especially things we were signed for. So our MRI zones and signage was not labeled appropriately. We had a generator test that was not completed annually with the load required. High level dust, infection control issues, where there was a syringe observed dropped on the floor, it was picked up and put in storage. I know people are nervous and that wouldn't be normal practice, but if anything falls on the floor, please discard it. Isolation gowns were not completely closed in the back. And we still are struggling with this. So we've ordered different gowns, different sizes, make sure that it's closed on the top and it's secured at the waist as well. Sterile processing, this is still a challenge with high level disinfection from the time of use until it goes to sterile processing. It needs to be completely wet with the pre-enzymatic cleaner at the time of use until arrival. So please look in your units if you have sterile processing equipment and for high level disinfection. Our surgical sets, when they were placed into the sterilizer, were overweight. We had 2 that they looked at. They need to be 25 pounds. We had 2 that were a little over. I know they're looking at this monthly and reported to infection control. And to my knowledge, we have not had problems with this, but don't let your guard down. Exit sign documented and inconsistent per CMS. It should say no exit, not an exit. I know it's picky, but a regulation's a regulation. And we had fire doors not closing all the way. Missing sealant tile. Next slide. Omnicell cabinets, they were not closed all the way. That was a magnet issue, and that was the first time that anyone ever observed that, but just make sure they are locked and secure. Multi-dose vials, they need to be dated when opened, beyond use date, 28 days from opening, or the manufacturer's expiration date. Several different things on PRN medication. You know, we had some cases where we gave pain medicine where we had scores of 0. We had other times where we gave pain medication, the patient had severe pain and we medicated for mild pain. And we also had times when we gave pain medication for severe pain and there was not evidence of documentation of follow-up. So I know it was done, but please, please, please make sure that you document everything that's required. Therapeutic duplication. There was one chart we looked at. We had a medication that was ordered for the same reason, 2 different drugs, same reason. That's considered therapeutic duplication. Medications orders need to be clear and accurate. We had an ICU drip going and it was at a different rate than the order. So again, our orders need to be followed. They need to be consistent and accurate. Next slide. Food line temperature is not recorded for policy. Breast milk not dated when opened. Oops. We had a consent that did not include at the time. Everything should be date, time, and signature. Inconsistent documentation on a patient record where the location was at ED radiology. We had this will be a big focus, health equity. We had one chart that we looked at, the minors. Parents' language was Spanish and the consents were in English. There was no documentation of a translator. We had a 19-year-old patient. I know that's unusual for us, but it does happen. But again, they fall into the category of advanced directive that we need to offer that opportunity and assess that question. A couple things regarding grievance. One, we didn't follow up per our policy. And then the second one, we had some cases where we didn't provide appropriate information for them to follow up if needed. Crash cart checks, make sure that you check that suction machine per manufacturer's recommendation. It's on the crash cart log. You turn it on, you make sure you have the green light, it's running, you turn it up, and you put your thumb over the suction device to make sure that you have full suction. Because the last thing you want to do is find out that it's not working appropriately when the time you need it. So those are just, again, I went over them pretty quick, but there's some high level just reminders of things that we were cited on. And just some things that we're hearing out there that they're focusing on. And some of them, you know, are kind of what I went over already. High level disinfection, sterile processing, all the way through expiration dates. Scopes are a huge focus. PPE and hand hygiene. Medications, high-low drugs, label and storage, medication safety, temperature, humidity, dust, especially in OR areas, failure to clean equipment per policy, primary source verification on our contract workers that require it, as well as our employees, sterilizers, our inspections, our PMs, sanitizing, all that they're looking at. Environmental care is always huge, and they're having a big focus on hazardous chemicals. Suicide risk, our assessment, our care plan, our documentation, and our behavioral patients throughout our organization. Consents and translator, just like we just discussed. Documentation of preferred language by patient and parent in our case. And then also, make sure staff know with department hack data or our PI projects, any quality indicators, things like this, and that we offer translator services. Those are some hot ticket items that they are hitting on. Next slide. And just a little bit of new information. About mid-January, we were contacted from CMS, which is the federal government, regarding a COVID-19 vaccination mandate. And we thought we were in good process, had a good process for this, and, wouldn't be a big issue. But to our surprise, one of the challenges with this is that it's not only for our employees, it also includes eligible staff, which it reaches out to our students, our physicians, our vendors, our contractors. So we have multidisciplined subgroup that's working fast and furious on development of a policy and how to manage this, because even though Joint Commission asked CMS to back off on this with surveying, this is a lot for us, and hospitals have been hit so hard with COVID that they are insisting that we have this in place. So they are scoring really hard on this, but we have a plan. We're working on it, and we will have this in place. So that's just what Cook Children's does. So stay tuned, and we'll have some more information on that really soon. And I also want to tell you that Kathy Eichner, our Jury Commission consultant, will be here February 28th through March 1st, which is just 2 days, on Monday and Tuesday. So I've sent an agenda to her, and so look for information to come out. We'll get to spend a lot of time on tracers. I've also asked her that the last 2 hours while she's here, that we have a 2-hour Q&A with all of our leaders and directors. And this is probably our last opportunity to have her here before we have a survey. So, and if for some reason survey comes when she's here, then of course we'll focus on Joint Commission survey. So just start thinking about things or questions or any clarification, because she's willing to have that 2-hour time period with everyone, and it'd be a good opportunity for some questions. That's about all that I have, and we're still waiting, and I promise you I'll keep you posted as I know information.
All right, thank you, Doreen, so much for being our resource and reference for Joint Commission. A lot of great tips on areas to focus on from our previous survey, but also current findings that we're seeing. So encourage everyone from a perspective of looking at this and going back to your areas to do a self-assessment, make sure we're in compliance. Any questions, you have folks to call, Doreen being one of them, to make sure that we're checking the boxes on the things that we either have been cited for or that we know that are out there, but full compliance is what our intent is. So thank you, Doreen, for that. Next up, we have Cami. Cami is going to talk to us about our system burnout survey for fiscal year 22.
Alrighty. Okay, so good afternoon, everyone. I'm absolutely thrilled to be here today and to introduce you to our upcoming burnout work. So I would start with a bit of an introduction before going to that slide that is displayed right now. So most of us have days when we feel helpless, overloaded, or unappreciated, when dragging ourselves out of bed requires the determination of Hercules. If you feel like this, most of the time, however, you may be burned out. Burnout, even if it has worsened since the pandemic began, is a phenomena that was in people's work experience for a long time now. People feel disengaged, anxious, stressed, overwhelmed, you name it, tired, not having time to live their lives or all together, all the above. So the good news, and I promise I have good news, okay? So the good news is that it is in our power to make a difference. And here at Cook Children's, we have an impressive organization support to make it happen. We just need each other, and we do need each other. We've seen this happening at Cook Children's in 2019. Actually, it's an ongoing work now when we assessed burnout for the first time for our physician population. And when we planned for a system approach in 2020. Well, the pandemic was in a way, but as an organization, we kept alive the commitment for a work environment able to unleash and grow our best as professionals and human beings. So we will continue with this journey this year with an organizational burnout assessment. Of course, we have a feel about what is happening with ourselves and with others around us. However, when we think about containing something as important as burnout and take action, we want to make sure that we have an accurate background and a solid starting point. So I will give you a bit more of an information about my last phrase, why we have to have a multi-angle approach in our work. Next slide, please. Okay, so, well, a promise for you is that we struggle and try try to promise that we're going to use the gold standards in our approach. So one of these gold standards is what is burnout, what we use as a reference for burnout. And maybe you have lots of readings here. Everybody's curious to hear about what's going on around burnout. So what we're going to use is this definition. And WHO defines burnout as a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. This is very straightforward. We're looking at 3 dimensions that can lead to burnout altogether. Feelings of exhaustion, so very much feel connected. Increased mental distance from one's job or cynicism, and reduced professional efficacy. Also, something important to remember is that burnout refers specifically to phenomena that are happening in the occupational context at work, not in any other areas of life we might want to consider. So now, if we want to have deeper perspective on this, to slice and dice for a more general understanding, for an easiness to get in this word and understand more and be more aware, I put together a short list of takeaways here for you. And I would start with the fact that burnout is a gradual process. So it doesn't kick in overnight. It builds up, is sneaky, comes slowly, but surely sometimes. It doesn't go away overnight. So it has to be work done around it to solve it. Burnout refers specifically to how individuals perceive and react to work environment or work-related stressors. We do not measure in our burnout work other stressors from other life areas like family, school, community, church. However, the interesting thing is that how we feel being burned out is definitely spilling over all these other parts of other areas of life, other parts of our lives. Burnout is also not classified as a medical condition, but can lead to very serious medical conditions. And one thing to keep an eye on in our work is the fact that is reserved, of course, in a negative way, I would say, is reserved to our best employees. We might see that those that are vocation driven, they're engaged, they have a meaning, they find a meaning in their work. They struggle probably very likely with burnout, more likely than other people that are not like this. Next slide, please. I would like to give you a bit more here, since we often hear around, I'm stressed, I might be burned out, I must be burned out. So we definitely want to provide you with the most accurate level of understanding, acknowledgement, to be able to be useful, to use this information for yourselves and for your teams, to be as close as we can, from the real truth here. So I try to put together a comparison between stress and burnout. Burnout truly has this stressor, so stress is a component and not the other way around it. They're not equals, right? So if we look, for instance, from stress perspective, by and large involves too much required. So I have to work on too much, let's put it this way. It has a mental component, but mainly is about physical component. Is too much, I just have an overload. While if we look at burnout from another perspective, is about not having enough left to give. So is that emotional drainage already in the conversation? And I put together a few, let's say, symptoms here that help us differentiate, make the distinction between the two. And for instance, just to name a few here, like stress is characterized by overengagement. So my engines are working really hard, high speed, I'm over-engaged to deliver against something. While when we talk burnout is, I couldn't care less. I took a huge distance from my work. I'm not engaged anymore. I just lost it. When we talk stress, we say emotions are to be, overreactive. I'm angry. I raise my voice. I fight for things. Well, when we talk burnout, it's like I'm absent. I don't even want to communicate. I don't want to share. I don't care. Stress produces urgency and hyperactivity, while burnout produces helplessness and hopelessness, that softness of not caring. So I will not go through everything, but before moving forward with my next slide, I just want to ensure you that we put together different levels of resources for you as leaders and for your teams. Feel free to use them as you want to use them. They're not mandatory to read, learn, or whatever, just to be accessible when you need them. And maybe even if just for satisfying your curiosity, okay? But we need you all to be in this effort together. So next slide, please. I would like also to give you a few things more Cartesian now, down on earth, right? On what's coming in terms of planning. And I just want to remind you where this system goal is hosted. It's actually under Engaged Workforce, one of our system goals, broad system goals. We want each person at Cook Children's to feel seen, heard, respected, and valued. So throughout this entire project, we are collaborating with different people across the board. We have this wonderful executive champion team with Kit Holt, Dr. Zurich, Nancy Cycle, Karen Love, Mike Simmons. We also have a core team that works together with us, multifunctional. So we pull together people from different functions to have a voice to say, to respond to their specific needs as needed. And we also work with our new physician advocates, physician well-being advocate people. They're doctors Kirk Pinto and Sarah Garza, and they were also participating in our first initiative in Burnout when we were started to work in this effort for physicians. So now an important date to know is April this year, because this is when our survey will start. We'll continue to share communication, as I said, in additional resources. One thing I would like you to know as we prepare for this launch is something that is not very common to other initiatives, other surveys and assessments at the organization level. Each person that will go through the process, when they will submit the survey, the response will receive immediately in their inbox an individual report. We work with an external provider. Everything is confidential. You'll have more in our communication, but it's important to know that people will have an immediate response with their own information, recommendations, where they are in this process. So one more thing, I probably went a bit over the 10 minutes I've been promised to have. So short, we'll be transparent in the process. And I think is good. Transparent doesn't mean not confidential, transparent about everything that follows. And one last important thing, I just wanted you to know that we work hard to ensure a follow-up of all this process. So our real work will start when we'll have the results of this survey. The survey is just a prep phase. So this is when the true work will happen. Thank you all so much for everything you do.
All right. Thank you, Cami, for that good information. And we'll look forward to the survey in April and the work that follows that. Real quickly, and Cheryl and I will close this out. Just want to remind everybody that everything that was presented here today on the Zoom is recorded, and the presentations will be on CookNet under the link titled Collaboration Forum. So we encourage you all to refer back to that. Might have missed something, but also to share it with your team. Please do that. That's the purpose of the collaboration forum, is to receive and present information, but also to share. Also we want to remind everybody for employee care that you can donate at any time, but there's a huge push through the February 28th through the end of this month. So get the word out on that. We're currently at about 64% of the 4,000 donor goal. So let's get that word out. One of our values is giving, and let's exemplify that by giving of our time, talents, as well as our resources. So great information on that. So real quickly, there's a few questions, and the first person who answers each one of them will be tracked, and we have a $10 Cook Children's retail gift card that we will send to you. So everybody get ready to log into the chat. The first question is, what's the maximum amount allowed for the Blue Peaks Giving Circle? Lauren mentioned that, but the question is, what is the maximum of amount allowed for the Blue Peaks Giving Circle, if I can speak correctly? So there's a dollar amount there that we're looking for. The second question is, at the Cook Children's Medical Center in Prosper, Kevin talked about this, but how many emergency room beds, exam room beds will be open day one? There you go. Got a lot of good answers coming there, and they're all correct. So whoever's the first one will get the card. Number 3, name one of the guiding principles of the Prosper transitional planning effort. Tara talked about several of them, but we only want one of them. Just get one. The first one that gives us one of those will get a prize. And the last question, Doreen talked about, we want both these dates. What are the 2 dates for our JCR mock survey? There's 2 dates. She gave a date that they're coming in, a date that they're going to finish up. What are those 2 dates? So the first person who answers any of those questions, you're going to get a good Cook Children's gift card. It'll be useful in any of our retail establishments in the organization. Build-A-Bear, Starbucks, the gift shop, wherever you want to go, Camelot Court. So we're going to look forward to getting those out to everybody. Okay, Cheryl, before I turn it over to you, I just want to let everybody know that the command center, the COVID command center, is looking at, with infectious disease and infection control, our current infection rates, both internally and externally, as well as guidance from our CDC or adjustments and protocols to look at what, if any, things we're going to recommend to leadership that we adjust based on. We're trending in the right direction. Hopefully you all have heard the numbers from Sharon in regards to the number of patients we have, the number of infection rates that we have, the number of employees are out, what's going on in the area. We're going in the right direction. We don't want to compromise safety, but we're going to be making some recommendations in the near future. I know there's been a lot of questions about meetings and business travel and things like that. We're going to be coming out with some guidance here in the near future. So stay tuned for that. Cheryl, you got a few minutes. You got anything you want to tell us about or wrap us up with?
I have an announcement. We have been notified from the Dallas-Fort Worth Great 100 committee that we have a Great 100 nurse among us. May be on the call. I can't see the whole list, but that is Christy Thornhill, who is our director with Care Team Foster Trauma and Surgical Excellence. She carries a big hat. So my congratulations to her. So, and thanks to everyone that submitted nominations. That's hard to ask everybody to do when they're otherwise very busy. We'll get all the details to the Jeff and folks so we can post that. So that's my big announcement. So, and then yes, our Prospercast. Let's not forget about that, and we'll have some announcements coming out about that. So we have staff that are able to join us and just let them know a little bit more about that secret place up there north, about 60 miles. That takes about an hour and 10 minutes to get one way, unless you hit traffic, and then it might be an hour 45. That would
Come on, Cheryl.
That's my trans.
Help me out here.
Hey, you're not going to want to live down here.
It's not in Oklahoma, but you can see it from there. That's
close. One star is right there.
Yeah, the picture. Don't let the picture deceive you. Our best to Pam.
Yes, Pam. Thank you. You saw all the comments. You're in our heart. We're excited for you. You got to share some of those fun stories. Keep in touch. We love you.
And that's what I have today.
All right. So just wrapping up, thanks to all of the presenters. You guys did a phenomenal job, each and every one of you. Thanks to Laura and Jeff and Lori and Gary and everybody behind the scenes that worked so hard to get this presentation up, as well as capture the notes so that we can refer back to them. Kudos to you all. Thank you to all of you for participating, even the ones that are not still on. Thank you for sharing your time on this busy day. I think everybody feels like Toby Maguire. Sometimes they're spinning webs and trying to hold everything together from Tara's illustration, but we can do this. The music in the beginning says, ain't no stopping us now. Thank you, guys.